Hi guys, this is Monday night. I just wanted to do one more thing here before you take the midterm, and I'd like you to see this. I mean, it's going to be quick, it's not going to be long at all. So I just want to make sure I've hit everything, that you need to know. So if you don't know something, go look this up, okay? Remember, I want you to know the anatomy, structure, and physiology, the function of the heart. Okay, both the right and left sides, where blood goes, how blood flows through it. Okay, I'm looking. Okay, I want you to know the three major signs, three major signs I gave you for a heart attack. Okay, three major risk factors leading up to a heart attack. Remember that a risk factor is something that correlates with something else. It doesn't necessarily show cause and effect. It just moves with something else. Okay. So just because you have a risk factor doesn't mean you're going to have a heart attack, but means the likelihood is you're going to have one. And I gave you three major ones. Okay, I want you to know about, remember we talked about aspirin and what it does? Okay, if you think you're having a heart attack, at least subsequent ones, right? And nitroglycerin, what that does. You may look that up on your phone or something. Know where the heart is positioned. Remember, a myocardial cell in a polarized state has a negative interior and a positive surface. In a depolarized state, that changes. Positive interior and negative surface. When it repolarizes, it just goes back to polarized again. I want you to know about the heart sounds, S1 and S2. And I said they're caused by the slamming shut of the valves of the heart. Okay, so know what causes S1 and S2. Know what your intervals are, normal PR, normal QRS. Okay. Know about the QT. What should that be during a normal EKG? Know what shows atrial and ventricular depolarization. And what shows repolarization. Yeah. And just want to make sure. Know about an EKG strip. You have one in front of you. If you're going horizontally, what does that measure and how much? If you're going vertically, what does that measure and how much? Remember, I told you there's some things you're going to need to do before you run the EKG with the machine, the electrocardiograph. What things did I tell you to do? Know about the electrical conduction system. Where does it start? Where does it end up? Know about Einthoven. What did he invent? Okay. Know about how many leads there are. Okay. So know about your limb leads, know about your chest leads, and know about what the limb leads. Remember, every lead is like a camera angle of the heart's electrical activity. Okay. Well, if I ask you, not that I would, but if I ask you, what are the lateral leads? When we talk about lateral in the heart, we're usually talking about left lateral. What are the inferior ones, so forth? Okay, know what represents MI when you're looking at EKG? Know about plateau phase? Know about rapid phase? Okay, when you're doing a lead, I may say, like in a lead 3, okay? The right arm is what? The left foot is what? Not that I would, but I'm just saying. Know about the leads in order. If you're looking at EKG, what comes off, first? What comes off second? What comes off third, and so forth. Know about planes. Remember frontal and coronal, transverse or horizontal? Know where the leads go. I think I mentioned this before, but if you're feeling your sternum, yeah, breastbone here, sternum, the upper part of the sternum, like right here, is called manubrium. Manubrium. Then there's the main portion, like right here, called the body. Then there's a little tip called the xiphoid process. Well, if you're going up to the manubrium and you feel this little notch, look where I'm at, right at the bottom of your neck there, okay? That's a suprasternal notch. Suprasternal notch. If you go down, just real slowly, if you go down, you feel a lateral little edge going like this, lateral, okay? You can also call it transverse, okay, or horizontal, probably better. Okay, horizontal. If you move right over from that, you're going to feel your first little depression, okay? So one way to get, okay, where you're at, like first, second, third intercostal space, so forth, is by feeling them, okay? Because when you go over in your first depression, that's the second intercostal space. Okay, know about the nervous system. We talked about sympathetic, we talked about parasympathetic. We said what the sympathetic secretes, like norepinephrine. We said what the parasympathetic secretes, acetylcholine, also called ACH. Okay. We said that norepinephrine is secreted into alpha, maybe little a, alpha, adrenergic stimulants. Because remember, sympathetic is like your gas pedal. It accelerates things. It gets you going. Parasympathetic relaxes you. Parasympathetic secreted into beta. Remember about artifact. Remember I gave you 3 types. AC artifact. I gave you somatic tremor and wandering baseline. Know what they look like. Know how fast things discharge. If I said the SA node, atrial, junctional, and ventricular, know how fast those areas discharge. Know what overdrive suppression is. Remember I said that an automaticity focus is like saying a backup pacemaker can become irritated. Normally doesn't, but can become irritated. Due to what? Stress, not getting enough sleep, stimulants, cocaine, Coca-Cola, they all seem to start with a C, okay? And it can fire. Remember, 150 to 250 when it becomes irritable. I gave you a simple way in another lecture to define blocks, first, second, and third degree blocks. You know about Mobitz 2. You know about atrial fib. You know about IVR, idioventricular rhythm. Remember, idio or idios means peculiar to this, okay? Peculiar to the ventricles. Know about sinus block, know about sinus arrest. If you get an escape beat, what's it escaping? You know about Winky-Bach, also called Mobitz 1. You know about V-fib. You know about PEA. You know about chambers of the heart that involve MI. What donates on an EKG? Ischemia. What donates injury? What donates infarct? You know about significant cues versus insignificant cues. I gave you that in a lecture. You know about your coronary arteries. Which coronary artery supplies what area of the heart? You know where your leads are placed. V1, V2, V3, V4, V5, V6. You know about biphasic P waves, what they represent. You know about the initial phase, the terminal phase of biphasic P waves. You know about bundle branch block, R and R prime. And then where would it be? How would we tell, is it right or left? How would we tell that? You know about hypertrophy. Looks like hypertrophy. It's pronounced hypertrophy. Hypertrophy, what that means. Remember, depolarization does what? It flows what? Downward and to the left. Downward and to the left, to the patient's left, right? So if we look at a wave, if it's flowing downward and to the left, like AVR, what would AVR look like? Would it be mostly, in other words, above the baseline or below the baseline? What's that statement I gave you? As a positive wave moves towards a positive skin electrode, there is a positive upward deflection on the EKG. If it moves away from a positive skin electrode, then guess what? There's a downward deflection on the EKG. Know what preload is, know what afterload is. You know about your cardiac enzymes, like which would be better, which would be considered the best, troponin or SGOT or what? You know about atrial flutter. What did I tell you guys about flutter? How to recognize it. What's the classic thing to do with the strep? You know about torsades, what it looks like. You know about the word agonal. It's a Greek word. It means dying, dying. So we could have agonal respirations, agonal pulse. Remember, for every minute that you don't defibrillate, what happens? How good is CPR in and of itself? Okay, now, what I need to tell you is this. I can't talk to you about the midterm. Okay, so if you call me regarding a question on the midterm, I can't do it. If you call me, you got the rest of the evening or tomorrow, right, on the midterm, I can do it. Okay, so, you need to call me before I put the midterm out. Probably sometime early Wednesday morning, I'll put it out. Okay, to be there. You've got 24 hours from the time that I put it up. Okay. All right. If there's any questions, give me a call. God bless. Thank you very much for your time, for your courtesy, and for your willingness to learn, especially during these times.